I'm delighted to say we're joined today by incredibly experienced and highly regarded consultant cardiothoracic surgeon, Mr. Ahmed um, Oliemy, which is fantastic. So he's going to talk about lung cancer surgery, robotic assisted lung cancer surgery to be more specific. So I suppose, Mr. Oliemy, the first question then would it be what are the key advantages, I suppose, of robotic assisted lung cancer surgery compared to the traditional surgery for lung cancer?
Well, hi, thank you very much for having me today. Well, robotic assisted surgery is a very recent technique performing different thoracic surgery, including lung cancer surgery. Robotic assisted surgery has many advantages. It provides precise surgical approach. It's very safe and it causes less complications compared to many other traditional thoracic surgical approaches. Actually, this reflects on the post-operative recovery of the patient. This provides less pain and shorter hospital stay, definitely. Probably most of my patients will go home following the surgery within 1 or 2 days afterwards.
Oh, that is fantastic. So the recovery time is a real benefit for patients.
Absolutely. Yeah, absolutely.
Oh, that's fantastic. So, Mr. Aliemi, leading us nicely then to the next question, which is how does robotic technology improve precision and reduce complications during lung cancer surgery?
Well, there are lots of technical aspects here which might be difficult to explain, but I'll try to give a broad idea about
Okay.
how robotic surgery works. So there are lots of technologies actually incorporated into the robotic system that I use. This includes 3D high definition camera view. Also, the camera has got an infrared technology in it that helps identifying the blood vessels and the blood supply to the lung and other organs. And you can imagine how this increases safety and helps with the surgical planning as well. The robotic instruments themselves are very versatile and they have very large range of movement compared to the traditional techniques. And this helps reducing tension on the vital tissues during surgery and increase safety and precision as well. Also, one of the very important features in the robotic system is the tremors cancellation technology. So, for example, if a surgeon has got some tremors or he's like suddenly did an unexpected movement, those movements will be cancelled at the patient ends. Thanks to the tremor cancellation technology there. So lots of technological advances. I just went through some of the main ones.
Fantastic, Mr. Aliemi. Absolutely. The development of technology is only going to get better and better for patients with lung cancer. So the future is very bright, which is excellent.
Absolutely.
And thank you for that explanation. It was very thorough and very helpful. So
Very
yeah,
good.
we're going to change the topic a little bit in terms of the primary features of robotic systems, such as the Da Vinci surgical system. Is this suitable for cardiothoracic surgeries?
Yes, absolutely. It has been in use for a very long time, and it's definitely suitable for thoracic surgery in particular. Let me just explain. Why we say robotic assisted surgery and not robotic surgery? Um, for the robotic assisted surgery, this means that the surgeon is in full control, but he's only being assisted by the surgical robot. So the surgical robot does not have any mind of its own. It's 100% controlled by a surgeon. And in
Mm,
the era of the AI, many would think that, oh, it's a robot and the robots will take over
Yes.
the world, and this this is not the case. It's 100% controlled by the surgeon. It only helps increasing precision and safety, and that's all. The system actually is made of several units. One unit will be at the bedside of the patient. This is called the patient cart and has got four robotic arms holding the robotic endoscope and the robotic instruments. This part will be controlled by a surgeon who sits on another separate unit, which is the surgeon's console. And, it has got like joysticks, like the, video gaming,
Oh,
like
yes.
joysticks, and you can control the robotic arms at the bedside to perform the surgery. Um, so yeah, so this is the overview of the system and how it works in general.
Excellent. Very interesting to kind of imagine, like you say, the video game controls, the joysticks, the Joy-Cons,
Yeah,
which is very
absolutely.
interesting. And it can allow the surgeon to be quite relaxed as well because it's an extra support, which is lovely.
This extra, it's a bonus for the surgeon, operating while, sat down, and, it's very ergonomic setup. And yeah, and you can imagine many surgeons would retire early because having like desk
Oh,
prolapse, neck
yes.
neck problems, back pains from, the other traditional approaches. So
Yes.
yeah, this helps a lot as well with the ergonomics and things.
That's a very good point. That it will actually make people's careers easier, longer, which is
Absolutely.
great
Absolutely.
news. Excellent, Mr. Aliami. So we have question four now for you in terms of in what ways do robotic assisted surgeries benefit patient recovery times, which you touched on before, and the post-operative outcomes? Do they improve maybe side effects from the surgery afterwards?
So let's get into a bit of details here. Thoracic surgery in general is an extremely painful surgery because this includes rib spreading to access the lungs inside the chest cavity. And the rib spreading can include breaking one or more ribs and stretching on the nerves supplying the chest wall. So you can imagine it's a very painful surgery. Robotic approach actually is performed through four tiny cuts in the chest wall, less than 1 centimeter each. So it's very minimally invasive. It does not cause disruption to the chest wall bony structures or mechanics, and this results in much less pain afterwards. And this in turn reflects on the hospital stay, as I explained previously, and helps the post-operative recovery. Patients can return to work very quickly, practice their normal lives afterwards, and also are ready to receive other forms of treatments if need be, like chemotherapy, for example. So some lung cancer patients would need some chemotherapy afterwards in the higher stage of cancer. So returning back to their normal activity levels after surgery helps them receiving those treatments timely.
Excellent. Okay, Mr. Aliami, that's fantastic. And then our next question then, how has the adoption of robotic assisted techniques impacted the role of surgeons in lung cancer surgeries? You did touch on it that they can sit down and they're much more relaxed.
Well, absolutely. So rather than, the more ergonomic features of the system that helps, the surgeons, there are also some other technical advantages that also would help changing the practice of many other surgeons. Before the era of robotic surgery, um, there were specific surgical procedures that were quite challenging to perform traditionally. One of those is the what we call limited lung resections or segmentectomies. Segmentectomies is removing a smaller sections from the lung, a smaller segments from the lung. It's suitable for selected group of patients with very early stage lung cancer, but they are very technically challenging, and many surgeons would avoid doing them because of, the daunting nature of the procedures. But after robotic surgery and the versatility and flexibility of the system, those procedures has become much, much easy and safe and very precise to perform. Also, other procedures that has changed after introduction of the robotic approaches, the mediastinal tumors, surgery for mediastinal tumors, and surgery for myasthenia gravis. Again, those patients used to have those surgical procedures performed through a split across their breastbone, which again you can imagine very painful and can take some time to recover afterwards. So yeah, this is the real impact on the surgical practice of many surgeons, other than the good ergonomics and the comfortable way of doing surgeries.
Absolutely. The benefits, there are so many benefits, which is fantastic. So,
Sure.
excellent, Mr. Aliami. So it actually puts us on then to nicely to our last question about robotic assisted
Yeah.
lung cancer surgery, which would be what potential advancements or innovations are expected in the future of robotic assisted surgery?
Yeah, well, the robotic techniques are continuously advancing, and every day we hear about new technologies, new systems that would help our group of patients with lung cancer or other conditions of the chest. So we are expecting the single port robot to be available very soon. So this is a robotic system that can be used through a single cut in the chest wall rather than three or four compared to the one that we are using now. Um, and you can just perform the whole surgery through a single cut. Other robotic system which has started to be very popular now is the robotic bronchoscopy. Robotic bronchoscopy is now available, and many units will be using them to achieve biopsies and diagnosis from the very early stage lung cancers. Those very early stage lung cancers are very small and mostly not accessible by the traditional diagnostic approaches. So,
Wow.
robotic bronchoscopy is very, very precise and can provide diagnosis in more than 95% of the patients.
Fantastic, Mr. Oliemi. Really, really insightful there. And I would just like to thank you. And if anybody is worried about a lung cancer diagnosis or if they'd like more information about robotic assisted surgery
Yeah,
for lung cancer, they can visit your Top Doctors profile at
absolutely. Yeah.
www.topdoctors.co.uk. And Mr. Oliemi has a lot of experience. And it's been our pleasure, Mr. Oliemi, for thank you
Thank you.
for your
Thank you
time.
very much. The pleasure is mine. I just want to add at the end that robotic
Yeah.
approach is not only for lung cancer, but I can also offer to patients with lots of benign conditions like excessive surgery for excessive sweating, surgery for diaphragm paralysis, and I mentioned before the mediastinal tumors and surgery for myasthenia gravis as well. So lots of procedures can be performed with the help of the surgical robot, including the ones that I mentioned.
Fantastic, Mr. Oliemi. Thank you so, so much again
No
for
problem.
your time. And it's
Thank
been our
you.
pleasure.
Thank you very much.
Thank you.